that is going to fuel the whole world of agriculture.
The day's deliberation, dubbed using biotechnology to fight hunger and poverty in Africa, led to the dilation of the many advantages of biotechnology.
In 2009, some 14 million small and resource-poor farmers in the developing world benefited from biotechnology crops, 90% of the world's farmers.
Regional integration was also stressed as it could yield more collaborations and help Africa attain its food self-sufficiency drive. According to officials, more conventional agricultural practices are needed, which makes biotechnology a very efficient strategy.
The Ministerial Conference of the ECOWAS countries on biotechnology, held in Bamako in 2005, adopted a series of guidelines and recommended ECOWAS to work out in consultation with CORAV and WICAT and SEALS an action plan for 1, the development of biotechnologies, 2, the adoption of regional approach to biosafety, 3, the production of information with the stakeholders. Although not a panacea in itself, biotechnology application can supplement more conventional agricultural practices and significantly contribute to agricultural production increase in the developing countries, which Gambia is one of.
This move could not have come at a better time, given the fact that already close to 40 million people suffer daily due to hunger or poverty-related issues. Enlightening policymakers at sub-regional level and how biotechnology can contribute to food security in Africa is seen as a worthwhile venture. For one thing, hunger is proven to be one of the most pressing issues on the continent. For Grts News, I am Ajami Sise.
Thousands of unqualified teachers from around the country are taking part in a training program funded by the World Bank and organized by the Ministry of Basic and Secondary Education for teachers in all the regions. The training, which focuses on math and English, is expected to increase the content knowledge of teachers in the said subjects as well as help them obtain credit passes when the project phases out in 2012. Muhammad Jamal Sise was in Kabafida Lower Basic School, where participants from Region 2 converged.
There never ceased a need for a more dynamic teaching force, one with the required professional know-how to deliver the good, particularly in math and English.
The objective of the sector is we want to help all our teachers at least to obtain a credit in English and math. Every teacher in government schools or government-supported schools. Yes.
With quality assurance as one of its policy statements, the Ministry of Basic and Secondary Education realizes how crucial adequate and quality teacher supply is to accomplishing that objective. The recent weeks of training targeting those certified qualified teachers is meant to increase their proficiency in English and maths.
Some time back, an assessment or a survey was conducted, and it was realized that we have some capacity gaps with some of our teachers in the areas of English and mathematics. And then the ministry was fortunate to have some funding from the World Bank to work on addressing some of these problems.
Over 1,000 qualified teachers are taking part in it in Region 2 alone. Some of the beneficiaries are already veterans but are convinced such an exercise is in place for them as well.
I could say that purely what I did was arithmetic and a little bit of mathematics, that is in the areas of geometry and algebra basic. But now I'm exposed to modern mathematics, and I think I would be okay, if not even to teach in the long run, but I would be able to coach my own children, even at home, to vast level in both English and mathematics.
To ensure efficiency of the program, many sectors are relied upon. The World Bank bankrolls it, the Basic and Secondary Education Ministry coordinates it, and the UTG implements it, selecting those tutors fit for the job.
Somebody may get a credit in English and math, but has he been teaching the subject? That's the question. We also look at that and see that these are very seasoned teachers who have got experience in these two areas, and we feel they can handle the program and then come out with something.
Since it involves such a huge financial and human resources, ensuring successful implementation of it should not be compromised. These teachers in Region 2 and cumulatively thousands of others across the country stand to receive, as a benefit of the initiative, sitting the private WAS exams sometime late in 2012 on maths and English, with high hopes that they will have credit passes. For Grts News, I'm Mohamed Jamal Sise.
A number of nurses from health facilities in the Greater Banjul area recently gathered for a day's training in diabetes education and conversation. Ndaibuso reports on the capacity building efforts organized by the Ministry of Health and supported by the International Diabetic Foundation.
Diabetics is seen as a silent killer disease that is threatening the world's population, reportedly killing at least a person every 8 seconds. Caused by a high level of sugar in the body system, the disease is also recording more than 1 million amputations every year. It is against this background that the Gambia Diabetics Association under the Ministry of Health and Social Welfare organized a day-long training on diabetics patients management and self-care for nurses from hospitals within the Greater Banjul area.
If you are not affected directly, you are affected indirectly. If you look at our wards today, most of the people who are dying are mainly from non-communicable diseases, of which diabetes is key, is number one. So getting people here to discuss on issues related to diabetes, I think we felt it very important, to be part of this very important meeting.
Dr. Mamadou Cham, Director of Medical Services, disclosed that out of the 340 million patients of the non-communicable disease, 80% of them are from developing countries due to the poor food available and lack of balanced diet.
Observe. You see, most of at the basic health facilities, they don't think about these conditions. For them, this is the way they are inducted. They think all conditions is malaria or pneumonia or others, forgetting that diabetes is. Before, diabetes was a disease of affluence. But now we are seeing this shift, because this food most of the time are cheap food, and it's the poor go for those cheap foods. Like the fatty foods, the rich people may never go and buy the fatty most of the time, but the poor will go for it because that's what they can afford.
One Gambian who has contributed tremendously to the collection of the 1995 baseline data and currently serving as the Vice President of the Global Diabetes Federation is Dr. Aliu Gay. Dr. Gay, in his remarks, said the increase in the number of diabetics patients in the Gambia is alarming, pointing out that more than 30,000 Gambians are living with the disease. He warned that this figure will rise by 2020 if nothing much is done to address the issue.
A wall about diabetes, and Gambia has got an estimated prevalence nationally of 2.5%. What that means is that there are 30,000 Gambians with diabetes, and that is going to double. That is going to double by 2020. In the next 10 years, it will double. The reason why the world thought that they had 30 million people with diabetes is because China wasn't studied. Now that the result is out from China, China alone has got 90 million people with diabetes. So the global estimate for diabetes, as I am speaking now, is 385 million people around the world today have diabetes. And in 15 years, that's going to double. You will have 700 million people. If nothing is done, in the next 10 years, you will have 700 million people. So we are sitting on a time bomb for disaster.
Mr. Saliu John, Secretary General of the Gambia Diabetes Association, implored the participants to make best use of the training since they deal directly with the patients.
Diabetes by itself is not a problem, but when neglected, the consequences can be there. That is when we talk of amputation, kidney failure, hypertension developing, and all that kind of thing. Now, my president, Dr. Aliu Gay, has a notion. To him, everybody is a diabetic, in the sense that you may not have it personally, but you may have a friend, a colleague, or a neighbor. So by equipping yourself with the knowledge of diabetes, you are able to help thousands of other people.
The world is acting now to the dangerous silent killer disease, and the Gambia is no exception in the crusade to fight this epidemic. Maribas Games, after representing the country in an overseas diabetics training program, is taking the lead in the anti-diabetics campaign. It is feared that the number of diabetics patients worldwide will rise to 760 million in 10 years' time. For GRTS News, I am Debuso.
More than 100 students from the University of the Gambia Wednesday embarked on a massive reading exercise on a 2-hectare rice field cultivated in response to President Jammeh's back to the land call. Fat Kamar Kebe picks up the rest of that story.